Gentlemen and ladies, good morning. I pray that you are doing fine and you're studying just fine to prepare for your exams, but most importantly, for you to be able to understand so you can understand the things that are coming in second year. So connective tissue is your last of the four major tissues that you are covering for this semester, and you're looking at tissue that supports all tissue types. And to start with, it is crucial that you understand that after you have learned this, you should be able to understand the following issues: the structure, the three major components of connective tissue, and the types of cells that you find in connective tissue that support other cells. Then we'll classify the different types of connective tissue, and then you should be able to give examples of these connective tissue types, and then we'll go into all those examples, and then you appreciate. So first of all, the three major components of connective tissue that make up the structure of connective tissue are the fibers, the matrix or the fluid part of connective tissue, and the cells. Okay, so the fibers are collagen, which are the largest fibers. We have reticular fibers, which are branched fibers. Then we have elastin or elastic connective tissue fibers, which are small but not branched. Okay, so if you are looking at a picture of connective tissue, the largest fibers will be collagen. Reticular fibers will be collagen, yes, but branched, smaller ones. And then elastic fibers will be the thinner ones without branching. Then the ground substance is basically the fluid part, which is a matrix, and it's jelly-like because there are these suspended components in there. So it is made up of sugar protein complexes, which are called proteoglycans. And you're going to learn in pharmacology that there are particular products that we give to improve the connective tissue, like proteoglycan containing substances or medications. Then the cells. There will be different types of cells, but basically the first type of cell you need to remember is fibroblasts. Sometimes it will come as fibrocytes. Fibrocyte is like the most mature part of this. Fibrocytes will be the less mature and they will have more synthetic ability. Okay, so fibroblasts, they produce fibers. Then we have immune cells. We have macrophages that provide defense. They are able to phagocytose substances that are foreign. We have plasma cells. The plasma cells, technically speaking, these are white blood cells that are able to produce immunoglobulins, as well as also called immunoglobulins or antibodies. Then we have mast cells. Mast cells are very, very important in producing allergies. Allergies that are a signal that you're exposed to substances that are not part of your body, and the body is trying to defend itself. So they produce histamine that produces all these allergic related reactions. Then we have neutrophils, which are white blood cells, lymphocytes, which are white blood cells. We have chondrocytes. Chondrocytes, they are related to cartilage, so they secrete cartilage material to make up cartilage that cover ends of bones to cushion the bones and reduce attrition and friction. Then we have osteocytes. Osteo relates to bones. Osteocytes and osteoblasts, you find them in the bone matrix. So they secrete bone matrix, all those crystals for them to be able to build the bone. Then osteoclasts, they are involved in what is called bone resorption. They digest the bone and recycle the bone, so we can have some of the calcium and all these substances that may be less in blood to be taken back to blood, or just to recycle and build the bone tissue that is able to help someone survive all these traumatic conditions. So in terms of classification of bones, what you learn in terms of classification of connective tissue is that, one, connective tissue, we classify it as connective tissue proper, and the rest. Connective tissue proper is classified into two main categories. There is loose connective tissue, then there is dense connective tissue. Okay, then the others will form into cartilage, bone, blood, and all these things. In terms of connective tissue proper, the best example is dense regular connective tissue. But here are the subclasses. Loose connective tissue proper, we have areola, we have adipose, and we have reticular. What are the cells we are going to find? Fibroblasts, fibrocytes, defense cells, as well as fat cells. What would be the nature of the matrix? The ground substance will have jelly-like, yes, and all three fibers will be present. Where do we find these in terms of general characteristics? 6 different types. They vary in the density and type of fibers, so they will be loose or they will be dense. Okay, so then dense connective tissue, we have regular, then we have irregular, and then we have elastic. Then the other examples that we have those that are not connective tissue proper. We have cartilage that will be subclassified into hyaline cartilage, elastic cartilage, and fiber cartilage. We are going to see that the major difference with cartilage is that it contains a lot of water, and you know, if you keep water in a contained space and it's not speeding, you can't compress it. So cartilage gives that non-compressive property to the surfaces that it will line and to provide cushion. Then we have bone tissue, we have compact and sponge type. Then we have blood that will form into different subclasses: red blood cells, white blood cells, as well as platelets. The next lecture or discussion will be able to show you the examples of these types of connective tissue and where you find them. Thank you very much. I'll see you in the next lecture.